Strategies to prevent heart disease. Heart disease is a leading cause of death, but it's not inevitable. While you can't change some risk factors, such as family history, sex or age, there are plenty of ways you can reduce your risk of heart disease. Get started with these 7 tips for boosting your heart health. 1. Don't smoke or use tobacco. One of the best things you can do for your heart is to stop smoking or using smokeless tobacco. Even if you're not a smoker, be sure to avoid secondhand smoke. Chemicals in tobacco can damage the heart and blood vessels. Cigarette smoke reduces the oxygen in the blood, which increases blood pressure and heart rate because the heart has to work harder to supply enough oxygen to the body and brain. There's good news though. The risk of heart disease starts to drop in as little as a day after quitting. After a year without cigarettes, the risk of heart disease drops to about half that of a smoker. No matter how long or how much you smoked, you'll start reaping rewards as soon as you quit. 2. Get moving. Aim for at least 30 to 60 minutes of activity daily. Regular, daily physical activity can lower the risk of heart disease. Physical activity helps control your weight. It also reduces the chances of developing other conditions that may put a strain on the heart, such as high blood pressure, high cholesterol, and type 2 diabetes. If you haven't been active for a while, you may need to slowly work your way up to these goals, but in general, you should aim for at least 150 minutes a week of moderate aerobic exercise, such as walking at a brisk pace. 75 minutes a week of vigorous aerobic activity, such as running. 2 or more strength training sessions a week. Even shorter bouts of activity offer heart benefits, so if you can't meet those guidelines, don't give up. Just 5 minutes of moving can help, and activities such as gardening, housekeeping, taking the stairs, and walking the dog all count toward your total. You don't have to exercise strenuously to achieve benefits, but you can see bigger benefits by increasing the intensity, duration, and frequency of your workouts. 3. Eat a heart-healthy diet. A healthy diet can help protect the heart, improve blood pressure and cholesterol, and reduce the risk of type 2 diabetes. A heart-healthy eating plan includes vegetables and fruits, beans or other legumes, lean meats and fish, low-fat or fat-free dairy foods, whole grains, healthy fats, such as olive oil. 2 examples of heart-healthy food plans include the dietary approaches to stop hypertension, eating plan, and the Mediterranean diet. Limit intake of the following: salt, sugar, processed carbohydrates, alcohol, saturated fat, found in red meat and full-fat dairy products, and trans fat, found in fried fast food, chips, baked goods. 4. Maintain a healthy weight. Being overweight, especially around the middle of the body, increases the risk of heart disease. Excess weight can lead to conditions that increase the chances of developing heart disease, including high blood pressure, high cholesterol, and type 2 diabetes. The body mass index, BMI, uses height and weight to determine whether a person is overweight or obese. A BMI of 25 or higher is considered overweight and is generally associated with higher cholesterol, higher blood pressure, and an increased risk of heart disease and stroke. Waist circumference also can be a useful tool to measure how much belly fat you have. The risk of heart disease is higher if the waist measurement is greater than 40 inches, 101.6 centimeters or cm for men, 35 inches, 88.9 centimeters for women. Even a small weight loss can be beneficial. Reducing weight by just 3% to 5% can help decrease certain fats in the blood, triglycerides, lower blood sugar, glucose, and reduce the risk of type 2 diabetes. Losing even more helps lower blood pressure and blood cholesterol level. 5. Get good quality sleep. People who don't get enough sleep have a higher risk of obesity, high blood pressure, heart attack, diabetes, and depression. Most adults need at least 7 hours of sleep each night. Make sleep a priority in your life. Set a sleep schedule and stick to it by going to bed and waking up at the same times each day. Keep your bedroom dark and quiet so it's easier to sleep. If you feel like you've been getting enough sleep but you're still tired throughout the day, ask your healthcare provider if you need to be evaluated for obstructive sleep apnea, a condition that can increase your risk of heart disease. Signs of obstructive sleep apnea include loud snoring, stopping breathing for short times during sleep, and waking up gasping for air. Treatments for obstructive sleep apnea may include losing weight if you're overweight, or using a continuous positive airway pressure (CPAP) device that keeps your airway open while you sleep. 6. Manage stress. Some people cope with stress in unhealthy ways, such as overeating, drinking, or smoking. Finding alternative ways to manage stress, such as physical activity, relaxation exercises, or meditation, can help improve your health. 7. Get regular health screenings. High blood pressure and high cholesterol can damage the heart and blood vessels. But without testing for them, you probably won't know whether you have these conditions. Regular screening can tell you what your numbers are and whether you need to take action. Blood pressure. Regular blood pressure screenings usually start in childhood. Starting at age 18, blood pressure should be measured at least once every 2 years to screen for high blood pressure as a risk factor for heart disease and stroke. If you're between 18 and 39 and have risk factors for high blood pressure, you'll likely be screened once a year. People age 40 and older also are given a blood pressure test yearly. Cholesterol levels. Adults generally have their cholesterol measured at least once every 4 to 6 years. Cholesterol screening usually starts at age 20, though earlier testing may be recommended if you have other risk factors, such as a family history of early-onset heart disease. Type 2 diabetes screening. Diabetes is a risk factor for heart disease. If you have risk factors for diabetes, such as being overweight or having a family history of diabetes, your healthcare provider may recommend early screening. If not, screening is recommended beginning at age 45, with retesting every 3 years. If you have a condition such as high cholesterol, high blood pressure, or diabetes, your healthcare provider may prescribe medications and recommend lifestyle changes. Make sure to take your medications as your healthcare provider prescribes and follow a healthy lifestyle plan.